And University of Colorado football coach Deion Sanders announced that he was cured of bladder cancer after a recent surgery earlier today. We took a look at just how prevalent the condition is. The Bladder Cancer Advocacy Network reports around 725,000 people are living with bladder cancer in the United States. The group states more than 1,200 people in Alabama are expected to be diagnosed with bladder cancer this year. Here's CBS 42's Maddie McQueen with what she learned from local urology experts.
Bladder cancer is the sixth most common type of cancer. That's according to experts with UAB Hospital. Dr. Charles Payton at UAB says bladder cancer is an interesting disease with a lot of variability.
You can have big wins and cure people, and then you have patients that are really sick and need your help as well.
Urology experts say there are two types of bladder cancer. There's non-muscle invasive, which is when the tumor is inside the bladder and lining but not attached to the muscle wall, and muscle invasive, when the tumor has attached to the muscle wall.
In the non-muscle invasive setting, we deal with this day in and day out. It comes back, and that's the biggest problem, is it comes back and comes back and comes back, often irrespective of the treatments that we give. With the muscle invasive setting, sometimes when we have really aggressive treatments, our cure rates can be pretty high. 70% at 5 years will cure folks.
Though doctors say about 70% of bladder cancer patients are men, it's a disease that doesn't discriminate.
Women have worse outcomes at every stage of the disease, and they tend to have delayed diagnoses because the symptoms of bladder cancer, the number one cause being blood in the urine, tend to mimic other less serious conditions that women have.
Dr. Mike Bivens is the president of the Urology Centers of Alabama. He says bladder cancer can be scary for many people, so it's important to be educated and know what to expect with the disease and treatment.
When we talk about a neobladder, you lose that sense of urgency to urinate. That is so simple, basic, and you lose that. To go from that to where you now have to rely on, pressure. You'll feel pressure just like you'll feel the pressure like your bowels are full of gas. That's what it feels like when you have to urinate with a neobladder.
The most common risk factor for bladder cancer is smoking, but the Bladder Cancer Advocacy Network says hairdressers and people who work with paint, dyes, or chemicals could also be at risk. Reporting in the newsroom, Maddie McQueen, CBS 42 News.